everyone. Thank you so much for joining us this evening. We really appreciate you taking your time and being here. So my name is Kayla Wilson, and I'm a CDC Public Health Associate. As part of the 2-year training, I was placed here at the Florida Department of Health in Manatee County. And I'm so grateful to be here. I live in Tampa, or close to Tampa and Brandon, and I just got very lucky being placed here. So I'm grateful to have this opportunity to be here with you all. I love connecting resources. I love connecting people to resources. That's one of my main goals anywhere I go. And I'm glad that we were able to, do this town hall and get your guys' opinion on, how can we improve our community health. Next slide. So we have a lot to cover, and so I won't waste any more time, and I will introduce our main presenter, Dr. Jennifer Bensi. So she has been the health officer for the Florida Department of Health in Manatee County since August 2009. So she's been here, you've probably heard from her. Let me think. So she is very involved in the community. She is a board member of the Manatee Memorial Hospital, the Centerstone of Florida, Manatee Healthcare Alliance, the Bishop Museum of Science and Nature, the Ivy League Club, and the Arts and Health Coalition. She has 25 years of leadership throughout the Florida Department of Health. And as you can see, she's been involved in different counties, including Orange County, Seminole County, Miami-Dade County, and Bay County. Next slide. And so we will also be hearing from Anastasia Peel and Brandon Vaughn. I will go over their credentials more when we get closer to them presenting. So without further ado, I will hand it off to Dr. Jennifer Bensi.
Oh, great.
Oh, sorry.
Thank you so much, Kayla. Good evening, everyone, and thank you so much for being here. We really appreciate your input. I want to thank also METV, so you are being filmed tonight, and hopefully we can spread the message of what we talk about tonight throughout the community in the next few weeks. But again, you'll be meeting my spectacular team. We're very, very fortunate here in Manatee County. It's all about the partnerships and the people who make a difference every day in our work in public health. So we just want to give you a little bit of a background about who we are and what we do. And then we'll talk more specifically about the community health assessment and get your feedback about moving forward with the Community Health Improvement Plan for the next 3 years. So anyway, we are the Florida Department of Health in Manatee. Some people still call us the Manatee County Health Department. We are all state employees. We work for the Florida Department of Health, but we have a dotted line relationship to the county, the commissioners and the team there, and they're very gracious to us, great partnerships. We get about $1 million in cash and about $1 million in kind, which includes the buildings that we're in on 6th Avenue East, and many other things as well. So all again about the partnerships. So as the Florida Department of Health, though, our mission obviously is to protect, promote, and improve the health of all of the visitors and obviously the residents in our community. So they added a few years ago to the mission, though, through the integrated state, county, and community partnerships. So it's all, again, about that. I can't emphasize it enough. And that's kind of my role. I kind of serve as the maestro and bring everybody together to make the symphony do its thing in the community and make a difference and improve our health every day. So as far as the state, the vision is to be the healthiest state in the nation. For us in Manatee, it's to be the healthiest county in the state and hopefully the nation. But we'll talk more about that in a minute. And our values are what we call the I-CARE values. So innovation, collaboration, accountability, responsiveness, and excellence. So all the members of my team, we work very diligently to make sure that we are demonstrating values to our clients who come and see us every day. Next, please. So again, that's our building on 6th Avenue East. We also have one now on Manatee Avenue where we have our community health team. And then we also have a building down by the Sarasota-Bradenton Airport as well. So really trying to branch out in the community with a few pilot sites also. One actually we've had here before COVID here in Palmetto for our WIC program, and we're hoping to bring that back soon. So right now we are the 14th healthiest county in Florida. About 10 years ago, the Robert Wood Johnson Foundation and the University of Wisconsin started ranking the health of every county in the country. So we compare ourselves to the other 66 counties in Florida. So about 10 years ago we started and we were in the high 20s. We've progressed every year in the right direction, went down to 9th, so broke the top 10 a few years back, and then during COVID we went back up to 13 and now this year 14. However, we're still very proud of the work we're doing and again having this conversation with you tonight to determine where we can make continued improvements. So our staff, about 100 employees full-time, our budget about $12 million. We do receive federal monies from the WIC program, for example, a lot of CDC grants. You'll hear more about the MRC program from Brandon tonight. And so there's those federal dollars. Obviously, we get the state dollars from the state legislature as a state agency. And then, as I mentioned earlier, county funding as well. We also write for grants from different organizations, foundations for specific programs. Next, please. I'm going to just give you some highlights of the programs that we do provide. Most people, I believe, still have the assumption that we are the clinic for the uninsured, underinsured in the community, and actually that responsibility falls to the federally qualified health center, which is MCR Health in our community. So the state legislature decided about 5+ years ago that if there were an FQHC in the community, they would be the ones doing that primary care. So public health has taken on a more core public health responsibility, which you really saw demonstrated during the COVID pandemic and our response to it. But these are some of the programs that we still do offer at the health department, which include a lot of focus on prevention and wellness, so breast and cervical cancer. Obviously, we do the immunizations, particularly for the children going back to school, the youngsters in the community, those traveling abroad. We have a wonderful travel program for immunizations that you may require. We also have a family planning program. We do still have nurses in the schools. We share that responsibility with the school district. We have the Immigration and Refugee Health Program, which is extremely busy right now in our area as well as others in the state and country. And so that's making sure everyone who's coming into the country is healthy and we can help to continue to protect them. Tuberculosis, still out there, very infectious disease. So our team goes out and makes sure that those individuals who have TB in our community are receiving the appropriate care. It's not every day like it used to be, but it's still a few times a week, and that goes on for months. So we want to make sure that the DIS, as we call them, our disease intervention specialists, are out in the community doing their work. Another area that they're really focusing on now is syphilis prevention, and really finding women who are pregnant who have syphilis, because it is totally curable before the delivery, which is really important. But having to find them in the community sometimes can be a challenge. So that is the role of the DIS workers at the health department. And then vital statistics. So we're responsible for the birth and death certificates, working with the hospitals and labor and delivery, and then also working with the funeral homes. But we can provide those to anyone in the state and beyond, regardless of where the births or deaths occurred. Some more information specifically about the different programs. So WIC, Melissa Rosenberg-Ehrman is in the back. She's our WIC director. So you've probably heard about WIC, Women and Infants Children. It's a federal program, as I mentioned earlier. Most people don't know really that it is for pregnant women and children up to age 5. So they're assisting with a lot of information for the woman during pregnancy, really talking a lot about breastfeeding education, helping those with immunizations. We also do a lot about assisting with the different programs for food eligibility, and then also providing other information in the community if they need dental care or if the children need any other services. The WIC team knows where they can get that. Next slide, please. Okay, so again, a big program here, disease control and prevention. You probably heard a lot about that and experienced that through the pandemic and saw our role in that. So epidemiology is the disease prevention and surveillance activities that occur in our community. So every day we're working with doctors' offices, with the hospitals, and there is a whole list that doctors are required to notify us if an individual comes in to their practice, to the emergency room, wherever, and they have any of these diseases. Some they need to call us immediately, some they need to call us within 48 hours, etc. And then we work with them to assist in finding out where the person got the disease and helping with the treatment, etc. During the pandemic, we've also worked working quite closely with the long-term care facilities in the community, helping the Agency for Healthcare Administration with any types of outbreaks in any of those type of facilities, as well as the jail and other places where there are a lot of people confined to a specific location. You're going to hear a lot from Brandon later on about emergency preparedness and response. This really started in public health after the hurricanes, first Hurricane Andrew in Miami, and then obviously after September 11th, 2001. That was my responsibility after that time, where there was a lot of money coming into public health across the country from the CDC and other national agencies to really build the infrastructure of the healthcare system. So making sure our trauma centers had everything they needed, making sure the hospitals know how to decontaminate individuals if they came in from any type of radiation or chemical or wounds, biological, etc. So we really have put a lot of emphasis in public health now on disaster response. We know in Florida that usually means hurricanes, and we need to be ready. My team, we're all responsible for being at the special needs shelter during hurricanes, and that is out in Lakewood Ranch, and that is to take care of more than 1,200 people who are signed up, who don't need to go to the hospital, but maybe are electrical dependent on equipment, oxygen, etc., and can't be in their homes because they could lose power. So that's where we come in and we run the shelter with nurses and our partners through the community paramedicine program, and it just really is a national model for our capabilities in that arena. Something new this year that we are one of 13 counties in the state doing what is known as the CORE initiative, Coordinated Opioid Recovery. So this was based on our numbers. We know that we had a fentanyl outbreak here that was tremendous during 2016. We did recover through partnerships again and CDC grants, but we still know that there's a lot of drug misuse, substance abuse in our community. So we were one of those chosen to pilot this project. And it's working with our partners at Centerstone Behavioral Health, the community paramedics, MCR Health, Drug Free Manatee, and the purpose is again to get those individuals who are going to the emergency room for an overdose into the system here, where they're working with peers. It's treatment programs, but it's a long-term relationship with that individual, so hopefully that they can move away from that drug and move forward in their lives. A huge program, probably the most regulatory program we have in public health in Florida is environmental health, our program and services there. I always ask the same question to everybody. Do you know who inspects restaurants in Florida? And everybody usually says the health department, and we're probably the only state in the country that does not. It was given to the Department of Business and Professional Regulation some years ago through the legislature, DBPR. But if there's an outbreak, somebody gets sick, people get sick at a restaurant, then we're called in to work with our partners there and try to determine from an epidemiological standpoint what's going on. However, we do a lot of other initiatives, activities as well. So we inspect and monitor all these places that you see listed there, from biomedical waste, so anybody who has red bags in their vet clinic, human clinics, those are all hospitals, those are all monitored by us to make sure those are all being addressed appropriately. Body piercing sites, food hygiene, places that have food like bars and movie theaters. That's what we work with as it relates to that issue. Group homes, healthy beaches. So there's a program, obviously, for those who are on the coast, and we're one of those counties. So we go out and monitor routinely the beach areas, which includes also, we know we monitor the red tide and the blue-green algae and all of that as well. And then Chris, our public information officer, would put out those press releases if we know that there's a beach that's going to be closed due to contamination. Migrant labor camps, mobile home parks, pools. Every public pool in the county is inspected by our team. Currently, it's twice a year. There's talk that it's probably going down to once a year and risk-based, but more to come. And that's why we stay very engaged with the Tallahassee and the legislative process to determine what changes occur in those statutes that are related to what we do, which is Chapter 381 predominantly. Rabies. This is a big deal in Florida, whether it's dogs or raccoons or other creatures. We have a lot of people that get bitten by wild animals in our community. So we work very closely with our epi team in the hospitals, making sure people get prophylaxed, get the right medications so that they do not develop the deadly disease of rabies in our community. Sharps disposal, we just opened up a new site for dropping off the needles, the dirty needles. In addition to our site here on 6th Avenue, you can also drop them off at our new site by the airport. And we also take care of the tanning salons and the tattoo parlors. So our team is out and about all day long doing their inspections. All right, community health, who you will spend more time with tonight, responsible for what we call the acronym world, CHAWS and CHIPS, Community Health Assessment, Community Health Improvement Plan. So these are done every 3 years around the country. Every public health institution has to do these. Obviously, last few years have been challenging with the pandemic, so we really feel this is a great opportunity now for us to move forward, get back on track, look for those gaps in our community. We have the Manatee Healthcare Alliance. Anyone is invited to join. We have over 100 members. We meet once a month, and the focus really is what are the gaps in our community as it relates to healthcare and what can we do about them. For example, a few years back, we saw a lot of people using the emergency room for issues that really didn't require their being there, right? And sometimes it was even food they needed versus a true medical emergency, and they would keep going back. So what we decided to do was to focus on community paramedicine. We had seen this in other places around the country. And so what this does is it allows paramedics to work with people who are leaving the emergency room who may be at high risk, and what they do is they go to their homes or where they live and work with them and social workers and also pharmacists from LECOM or from Centerstone. And what they do is they make sure the person is on the right medications, that the medications aren't interacting with one another, that they have all the support they need, link them to care in the community, and eventually get them where they need to be so that they can live a productive life, a healthy life in their home. Even they're doing evaluations for slips and falls, those type of things, so that they really can avoid those emergency room visits moving forward. You'll also hear tonight from our team that we do a lot of programs as it relates to healthy baby initiatives, healthiest weight, worksite wellness, tobacco prevention. We work with students, the SWAT team, students working against tobacco. Basically, we approach it as prenatal to those older years, okay? And I'm there, so I don't know what to call them anymore. I'm in denial. But by approaching those different phases of life and the different health issues related to those times in our lives, we can focus on the marketing and the interventions, and also culturally as well. Obviously, we're in a very diverse community, which is wonderful, and how to culturally social market our messaging to the communities so that we are being able to have those conversations with them that really will make a difference. And that's all I have right now, so I'm going to pass it on to Brandon. I think Kayla's going to do a brief introduction, and he'll tell you a little bit more about a wonderful program called the Medical Reserve Corps. Thank you.
Thank you, Dr. Bensi.
Microphone.
Do you not hear it? Do you hear it? Okay, sounds good. So I don't, miss anything, I'm just going to read out Brandon Vaughn's history. So he has 5 years of experience in public health and healthcare, and this includes emergency management, volunteer management, and hurricane preparedness. He holds a master's in public health from the University of West Florida and a bachelor's of science in public health from the University of South Florida. And so they're just almost finishing up. Did anything surprise you guys that the Florida Department of Health does that you didn't know already? Anything stand out? I know when I first joined, I didn't realize they did the emergency preparedness as much as they did. So luckily, Brandon will tell you more about that.
Thank you, Kayla. Good evening.
Good evening.
Glad to have you guys here. So I am the coordinator of the Minnesota Medical Reserve Corps. This program, our MRC was actually started in, I believe, 2010. It's been around for a while. The MRC itself was started in 2001, and it was started after 9/11. So what happened when 9/11 happened, they had a whole bunch of people, volunteers, that wanted to help out. And they hadn't been vetted. They could say that they were a nurse, a physician, respiratory therapist, but there was no way to quickly vet them and look at their credentials. The MRC was intended to address that gap where you have volunteers that augment, they support existing emergency medical services. Our volunteers, I have about 25 of them. They have been checked. We do background check and license checks for the medical volunteers. Medical volunteers can include nurses, physicians, paramedics, EMTs. I came into this role in November of last year, and when I started this role, I had 2 boxes of papers, and it was a little messy. And since then, we have rebuilt our MRC so that all the volunteers are, I know who's active, and I have them out in the community. I try to do it at least twice a month to keep them active. Now, the volunteers themselves, they're all local. They're all familiar with Manatee and Sarasota counties. Some of the events that we have done on the next slide, you'll see that we have done an airport training exercise. That's every 3 years. They call that Padre. So that got them a little bit of, the Padre is not something that we would normally respond to, but it was a way to get the volunteers working together, get them gelling, they can see each other again. We have done some running marathons. 2 of them were in Venice this past March and April. We've also done Manatee Pride. That was, I believe, last month as well. That was very popular with the volunteers. They were always asking me about it, and so we got them to do that. And then we did the river regatta. Did anyone go to the river regatta? You went to the river regatta. So it's like one of the biggest gatherings in Manatee County. The MRC, we have participated in the river regatta every year, and I think it's been 8 years if I remember correctly. So we're always there. We had 2, you can see we have the bus that DOH uses over here, and then we have our own trailers. We have 2 trucks, 2 trailers, and then we have a lot of supplies for basic life support. So we have automatic defibrillators. We give out certain medications. and then we have all of our medical are licensed to address those needs for people. You can see here in the past, these are some of our our actual volunteers. The first gentleman you see with the baseball cap, that's Roger. He's one of my best volunteers. He's a joy to work with. All of them are. You can see that we have our custom-made golf cart there, and that can actually we can use that for transport. I know the EMS sometimes depends on us to provide that kind of transport when they can't get their ambulance into a certain location. Also, some of our supplies that we have, they have used that. We have a lot of capabilities. Scope of practice may be a little limited. They can't do advanced life support, but we're there just to support community events. Dr. Benz, you talked a lot about about community partnerships. I do work closely with Manatee EMS and Sarasota. I have worked with Sarasota EMS in Venice. So there's a lot that I do. It's we also fall under preparedness and hurricane preparedness. So that's something that to keep in mind. Hurricane season is coming up, so that is something that that I do work closely, and I get trained with people for to be prepared for that. That's all I've got for you guys at this time.
I have a question. Do you guys hold any community classes, like CPR classes, or how to apply a tourniquet, things like that?
We do have CPR. Roger, he is trained to teach CPR, and then we primarily do that online. It's really affordable, and then he can do the skills assessment. We also work closely with other departments at the Department of Health. I work closely with Community Health, handing out some materials. Like, we'll be at the Hurricane Expo this Thursday. Are you guys going to that?
Yeah. It's an expo.
All right, good. So that's a good way to get prepared for hurricane season. So we will be there. We'll have a table, and we'll have some materials to hand out for you guys.
And poison control, and kids get in and drink like Drano or something like that?
We don't do poison control. I don't know who would handle that.
Throughout the state, don't we partner with them?
Yeah.
Prevention activities, there's that number you can call right with the hospital.
Yeah. Do you have any other questions? Anybody? No? All right. Thank you for your time. I really appreciate it.
Thank you, Brandon. All right, so our next presenter will be Anastasia Peel. So Anna is the lead health educator, consultant, and designated minority health liaison for DOH Manatee. Anna has a master's in public administration and is a certified Lean Six Sigma Green Belt. Most recently, Anna's accomplishments include co-leading the Strive for 365 team at DOH Manatee, using the Lean Six Sigma Green Belt to reduce the Black infant mortality rate in Manatee County. This project won the 2022 Florida Sterling Council Storyboard Competition and the 2023 Tax Watch Productivity Award. And so she's just getting set up there. All right, there you go.
Okay. Good evening, everyone. And it's a pleasure to see you all again. I think I've met just about everyone in this room already. So I promised I would tell you about the survey I was going around talking about. And so the community health assessment, Dr. Bensi already talked a little bit about it, but it is to collect and analyze information. We identify new uses for resources, adopt and revise policies, plan actions and activities to improve community health. So with public health, there are three core functions, which is assessment, policy development, and assurance. And most of the time when I say that, people look at me and say, Anna, what are you talking about? But what we do throughout many of everything we do is figure out what needs to be done, which is the assessment piece. Policy development, how are we going to get this done? Now, once we figure out, okay, how are we going to get this done? How do we make sure that it gets done? And that is the basis of basically all of the plans that I'm going to talk about today and everything that we create. With the community health assessment, this is how do we figure out what needs to be done. And so some of you have already taken the survey, and so you see that we ask you, what do you think the 3 health problems are? What do you think unhealthy behaviors are in the community? So why do we put this out in the community? We need to get an answer. I would like to get an answer from everyone in Manatee County, so I think that's a little over 400,000 responses, but we know that's not going to happen. The idea is to get a sample that is reflective of our population. Everyone has a different idea of what it is to be healthy. If I asked you right now, what does it mean to be healthy to you? Somebody yell something out at me. What would you say?
Active.
Being active. Anybody else?
Balance.
Say it again.
Balance.
Balance. For me, it's mental health and bringing my lunch every day. So we're all going to have a different response on what it is to be healthy. So that's why we need all of the responses from you all. What we do when we get those responses is we analyze it. And so what we'll do is we'll look at it and we'll say, okay, people think, okay, obesity is unhealthy. Some people may say domestic violence is an unhealthy behavior. Drinking may be looked at as unhealthy. And so we'll look at what the folks are saying. We also do key informant interviews. So we'll talk to specific individuals who are leaders in the community. Maybe this is a first lady of a church. Maybe it's a leader of a hospital, to get their perspective on the populations that they are serving. We'll also do focus groups. So maybe we'll meet with a senior group to see, well, what do they think the health problems are? We'll meet with youth to see what do they think the problems are. They may have a totally different perspective being in the school system versus someone who is working every day. And so we collect all this data, we look at research that's out there. Once we do that, we compile this big report, this big beautiful report that we will put out to all of you called the CHA, the Community Health Assessment. You can go to the next slide. And so these are what we're asking you to do this evening. I think just about everyone in here has taken it, so thank you. And so I have another call to action for you. Please share it. This survey is for everyone who lives, works, plays, and worships in Manatee County. And so I would love for you to share it with, you just share it with one other person and then extend that call to action to them to share it with one other person. If you have an email distribution list that you can send it out to, please do that. We really want to have a sample representative of the community. So, bonus question, does anyone know when the survey closes? May 22nd. So you still have a little bit of time to get it out.
And there's materials here you can take with you to share with others. We have the Braden
Absolutely.
Sparrow article on it. We have the flyers with the hyperlinks spelled out. If you want to take any of that material and share with others, please feel free to do so.
And a couple of you signed in and have your emails. If you say, Anna, email me, and I just will forward your email, I will do that. So however you need to get it out, we will make sure that we help you get it out. Next slide, please. I want to talk a little bit about the Community Health Improvement Plan, because some people ask us, well, what do you do after you develop the CHA? Does anybody have an idea what we may do? So if we're thinking about our 3 core functions of public health policy development is kind of the next step. So how are we going to get this done? So we developed it, we figured out what needed to be done, we did our investigation, we did the fun part. Okay, here are all of the problems. Sometimes it's a little overwhelming, I tell you. But then we meet with all of our partners and we say, look, here are the problems. Now we have to prioritize some things. While we would love to focus on every issue that we see, it's impossible. And we cannot do it alone, which is why we work with partners. All of the partners, Dr. Vinci mentioned the Manatee Healthcare Alliance, will get together. You're welcome to join if you like. And then we prioritize these issues. So there's a formula how we do this. And then once we prioritize those issues, we create what we call subcommittees. So if you say, Anna, I don't want to serve on the Alliance, but you have a particular issue that's of interest to me. Maybe that's obesity. So I want to serve on a subcommittee. You can actually serve on that subcommittee and help develop the work plan. And what is that work plan? With that work plan, we develop goals, we develop objectives, and the fun part, activities of what we're going to do to solve this particular issue that was identified in the CHA. And I'll give you an example of one that I'm really passionate about and I love. We identified nutrition as an issue. And we looked at a particular population, infants. And so we know that breastfeeding is great for infants, and there's a lot of things we can do around breastfeeding. Our WIC department does a great job. We have various partners, Manatee Memorial, Healthy Start in the community that do a great job of those things. So what did we decide to do with our subcommittee? We know that women need support when they're breastfeeding, especially when they go back to work. As a subcommittee, we decided we wanted to focus on making sure that workplaces have policies in place that support women who are breastfeeding. So what we did was work with the Florida Breastfeeding Coalition. They have this great recognition program, bronze, silver, and gold levels that basically say, hey, if your workplace has these policies, if your workplace has a lactation room, you qualify to be recognized as a breastfeeding friendly employer. So what we do with the subcommittee is promote that. And so I'm excited to say that there is a child care facility that was just awarded. Sunshine Christian Academy was just awarded as a breastfeeding friendly child care center. And then we have Manatee County government that has a policy and just submitted their application, and Parenting Matters that also has a policy and submitted their application. So those are wins that we get to do with the subcommittee. So if you all are interested in being part of that great work, I would encourage you to reach out to me, and I can get you connected with the Alliance, and we can work together and do some really awesome things in the community. Anybody have any questions about it?
Good job.
Okay.
I have a question.
Of course.
Is this going on statewide, or is it just here in Manatee County? We're trying to assess the entire health of the state of Florida.
So what we're doing specifically in Manatee County is for Manatee County, but yes, to your point, there is a state health improvement plan and there is a state health assessment, and our state office runs that. So what we do is we'll also look at that and we align back to the things that we're doing. But it's interesting, when they do their analysis, when we do it within our counties, most of the time we're seeing the same issues. So.
Can I share a couple stories?
You want to share a story?
I'm going to share a couple stories.
You want this?
Can we do this? Yes. I'm Chris Tittle. I'm the Communication Director at the Florida Department of Health in Manatee County. I served at the Florida Department of Health in Monroe County a number of years back when we were doing this. And a couple of really interesting things came out of this because of the public's participation in this survey. It was determined in Key West that there was an underserved neighborhood, Bahama Village, that was in need of upgrades to playground equipment. The kids were not able to go. I mean, it was the kind of wire, steel frame, metal jungle gyms that we had when I was a kid that were dangerous. A lot of the toys had been worn out and all. The city of Key West took notice of the survey results. We happened to have a city commissioner who actually worked as an HIV prevention specialist at the health department, so that kind of helped a little bit. But we got the information to the city commission, and they went ahead and dedicated $1.2 million from the sale of a piece of property that the city owned right near the hotel area there on Key West Bight. They donated $1.2 million to that playground fund, revamped the whole thing. Even the swimming pool, the giant swimming pool was there. New equipment, kids were out, they were all over it. And it was all because of people in the community who answered questions on this survey. They laid out the particular concerns they had for kids. The city caught wind of it from the survey, and they went ahead and put some of that money toward that. Another issue in that same community, there was concern, and this is really interesting because I think when we talk about health, we talk about nutrition and exercise, very, very important. But I encourage you to cast the net up wide here. In this particular case, people of Bahama Village were concerned about crime. You know, how does crime translate into public health? You're getting mugged and hurt. You're rape. There's all kinds of things that can happen that are related to crime that are directly related to public health. In this case, they were concerned about a lot of, I guess you'd say, darkness in their community. Darkness where open air drug markets could be run, where people could get mugged and all the rest. So we took the survey, the concerns that they expressed through the survey, through the public, and determined that part of the problem was that a lot of the old trees that grow in Bahama Village, their leafy limbs were covering over the street lights. So we had streets that were totally dark at night, completely dark. So they went in with the electric company. The electric company went in and trimmed all these limbs, and suddenly there's light. Open air drug trade drops, crime drops, public health improves. So these were really great examples, I thought, of the direct effect that the public has through this survey in getting your elected officials, your utilities, into the public health game in ways that really truly did improve public health. I mean, the responses were just so directly obvious due to the survey. I was really proud. I was really excited about it myself, frankly. Yes.
On those lines, Chris, you brought up a really good point. I didn't explain well how the health of a community is evaluated. So 40% of the health of a community is based on socioeconomic factors like Chris just mentioned. Education, crime, all of these factors that come into play. Homelessness, I've heard it mentioned in the back tonight. 30% are those individual choices that one makes. Substance abuse, and other personal factors that come into play. 20% is actually access to care. So having that infrastructure in your community where you have places to go and get proper health care and those providers. So we're always looking at our numbers and working with the schools. We need more nursing schools. We need more medical schools. We need more of all of those allied health programs as well. And then 10% is the environment. So again, for us locally, the blue-green algae, the red tide, and how does that affect individuals' health from an asthma perspective, et cetera. So that's how they're monitored. And going back to your question earlier too, Richard, it was also required of every county in the country that they do these assessments every 3 years and make sure they work with their hospitals, because it's also required by the hospitals in every community that they participate. So again, as Anna was mentioning, the importance of these partnerships and bringing everyone together. You also mentioned the importance of faith-based partners, because they are able to message quite a bit for us in terms of public health in their different communities. So absolutely. Do you have more questions for us? Input? We're open ears tonight. We don't want to be the ones only talking here.
When are you expecting to have the results of the survey and start developing the next part of the plan?
Great question. So the survey closes May 22nd. After that, we'll compile all the results. So if you want to join the Alliance meeting, we're actually going to give a sneak preview on what this survey said at the end of May at the meeting. But in June, early July, we're expecting to have a draft presentation, a draft version of the assessment. It has to go through a few approvals locally and statewide, and then it will be published to the public. So this is for 2024 through 2026. So published to the public definitely by January 2024. But if you want a sneak peek, I would encourage you to come to the Alliance meeting, because we'll be talking about it more before it's fully published.
I can share another story with a broader vision. I lived in North Carolina for a year, and would go to Greenville, South Carolina every once in a while to go to the Swamp Rabbit Trail. I don't know if any of you have ever heard of this before. But based on the survey results conducted in Greenville, the same type of survey from the public, the hospital association there in Greenville they found an old rail bed about 30 miles long from the center of Greenville out to the edge of town. And they paved it over with a very wide path, and they created the Swamp Rabbit Trail, which is all about businesses that promote health all along the trail. So you rent a bike at mile marker 2 and you ride out the trail, and there's a fresh fruit and vegetable stand you can stop. There's a cafe that serves healthy foods. There's a gym. There's an outdoor yoga place. As you're riding out on this trail, it's all about health, and it's public. It was something that was inspired by the results of this survey that the Hospital Association bought funding for. They actually put up some old rail cars along there as a museum. So as you're going along, you can stop and learn about the rail bed that you're actually riding on. I must have gone on that thing 10 times. It was awesome. You could rent a bike and just ride for 10 miles. And there's the farmer's market. They did everything. It was every Thursday. It was just all about promoting health. And it was all the results of the survey that the public took and said, we really need this here. And now they use that as a way to market apartment complexes, condominiums. You're just a half a mile from the Swamp Rabbit Trail. And that brings revenue. You know, people develop, they want to develop near the Swamp Rabbit Trail. It's a big attraction.
Sounds
And-
like the Realize Bradenton.
Yeah.
And they're
Exactly.
on the waterfront now, too. We're seeing a lot of that expansion. as
Exactly.
well.
It's something that's local, it's about locals, people are enjoying it, they really benefit from it. And revenues comes to municipalities through that, because developers want to develop near something that's so popular. Really, in fact, if you ever get a chance, go, because it is great. Spend the whole day, it's just fantastic.
So all of the initiatives that we're talking about, I know we spent a lot of time on the community health assessment. So after we do that, all the different initiatives, all the different projects, the work plans, the subcommittees, it wouldn't be public health if we didn't bind that up into another beautiful plan. So we formally call that the Community Health Improvement Plan. So that is the logical next step. After an assessment, you create an improvement plan, and then we report on that every single year. So for us, it's every 3 years. We'll have subcommittees working on the different projects and initiatives. They report out monthly on progress every month at the Alliance meeting. And then annually, we do what we call an annual review and a progress report update to show how much progress we've made on the community health improvement plan. So we'll do that. We're actually in year 3 of our current one, which is 2021 through 2023. So we're wrapping it up. We'll do our annual review around November. So if you're interested, you can kind of see what we have done so far. But simultaneously, at the same time, we're planning for the next year. So it'll be interesting to see what the results say. Are they similar to last year? And maybe we'll build upon some of the things that we're doing now. Or maybe the community will tell us something different. So it'll be interesting to see what you all tell us.
And if I could add too, there's a website called Florida Charts. You can go in there, you can click by county, and it gives you a lot of data on all those indicators that are measured, and you can see how we're doing, and there's a dashboard, are we red, green, or yellow with that initiative. So also might bring some ideas to mind for those who are going to be taking the survey if they haven't yet, but please look at that as well. But we would love to hear from you. What are your concerns? You came here tonight. We really appreciate you taking the time. Anything stand out? I heard homelessness early on, and we're hearing a lot of that in the community right now. Other priorities that we can take back to the Alliance as well?
That comes to mind when they see the homelessness and they drive on Bradenton.
Would you like to?
I don't need a microphone, I got a
Okay,
loud voice.
okay.
But the mental health comes in line with the homelessness
Absolutely.
in like a personal level. Not that I work in that field, but as you drive, you can't help but see.
Absolutely, and we're very fortunate. Actually, Melissa Larkin Skinner is the CEO of Centerstone, and she is actually our chair of the Alliance currently. So she keeps a real close eye. I happen to be on their board, and I know they're doing great work. And again, a lot of partnerships with NAMI and all the others, First Step, all the others in the community. But again, a great need for more. They're expanding the hospital some there, and that's why we have the CORE initiative as well, kind of a mixed blessing, right, that we were chosen as one of the top counties needing it, but again, the resources are coming to improve the efforts there through a lot of peer support.
It's interesting when you think about an issue like that, how multi-armed it is. I mean, when you see somebody who's homeless, you know, sleep issue, where are they going to sleep tonight? Are they going to get robbed? Are they going to go take drugs? Are they going to break into somebody's house? I mean, you look at somebody who's homeless, and it's not just a matter of behavioral necessarily issues, but it's all the other things that can influence their health by being out on the street. And you know, people who are out there who have the signs they want money, they're dehydrated. The sun is beating down them, and there's so many issues connected to that just homeless alone doesn't really encompass everything. And so there could be an issue on hydration. There could be an issue on nutrition. It could be an issue on safety. Again, casting the net wide in terms of public health, just beyond nutrition, exercise, which are all great, but there's other public health related concerns out there that may be something that you see every day in Manatee County that might be something worth addressing.
What about like something like screen addiction? Is that something that is a concern or being a concern with, maybe 10 years down the road or something like that, 5 years down the road?
I'm sorry, what kind of addiction?
Screen addiction.
Screen addiction.
Yeah, I can speak to that a little bit. So I'm glad you brought that up. So a part of our Healthy Communities program, it was previously called Healthiest Weight. And we look at, the health of a community. And in our work plan, we specifically work with early child care centers, looking at children ages 0 to 5. And our coordinator who works with that program goes in to assess different policies that a child care center may have. We have some partners around the state that work with us. We use a system called Go Knapsack. The center is able to take a self-assessment to see how they're doing in certain areas. To your point, one of the areas is screen time and making sure that children are getting the appropriate screen time. And usually at that age, I believe it's like 30 minutes a week, if that. So they are looking at it at ages 0 to 5, and it's definitely in the literature and the tools that they're giving us to go to early child care and education centers to make sure that those centers have policies around that.
Other areas that you want us to focus on?
So one that I would like to add is that I work with Manatee County, a part of the Children's Services Department.
Awesome.
And one of the things that actually came up today in a meeting with one of my programs is that the children ages 0 through 5 are the least focused when it comes to school and early care and early education. Their concern was, is there a way that us as a group with Manatee County, can we get these kids to be like a regular thing, to have them screened before they enter school, because a lot of parents won't. And they want to see if, like you potty train your kid because that's normal. They would like to see screenings being normal, because sometimes when you screen a kid, it's not necessarily late, but they're going to be very behind because the parents didn't want to do it in the first place. And that brings a kid back who is going to be in a whole bunch of different risks in Manatee County, needing to receive extra care, extra education, which is not a bad thing. We have a lot of services here for that. But if we could prevent it and give them the help they need early on, that would be great.
Good point. Early Learning Coalition does a lot of good work for the kids.
It's working anyways.
Yeah, the Early Learning Coalition does a lot of work with kids between the ages of 0 to 5, so maybe that's something we need to bring to the table along with them, how to start screening and maybe make more awareness of the Learning Coalition and the services that they provide to the parents. So I think it's possible very much to work on that. I'm on a board of the Early Learning Coalition for Manatee and Sarasota both, so we can definitely have a discussion on that at one of the future meetings. Right. That is for the survey.
She just did it verbally.
She's here, our WIC director, and because that's that
She's gonna
0 to
type.
5 group that she is and her team work on every day.
Yeah, that's a really good point. I mean, we're serving that same age group at WIC, the 0 to 5. So if there's a way that we can partner more to get these services out, I mean, that would be amazing. I know we do some promotion of different events that the Early Learning Coalition has, and we do promote services, but I think we could do even more. Yeah, there's no sense of us.
That we see, then definitely that is something we need to look at.
Right. There's no sense all of us working in our little silos. We need to come together, and that's really the way you make an impact. So yeah, I have your card. So whatever we can do to work together, that would be awesome.
One presentation at the Learning Coalition board,
Yeah, that would be great.
so they can take a look at that.
All right. Awesome.
Is Early Learning Coalition one of the Upper supporters?
They are a part of our distribution list. Paige works very closely with them, a part of the Healthy Communities Work Plan, because she works specifically with the early child care centers, and Dr. McGill is also.
Yeah, Dr. McGill's on their board. Other ideas, please? Suggestions that come to mind? No? Okay.
Affordable housing on the registration, when we asked, that was a big topic. Well, I was just curious if you guys had any projects in mind or anything you've seen done in other counties or other areas regarding affordable housing, and what kind of projects, if you have any thoughts.
Housing is a big issue everywhere you go.
Right.
It's a hot topic. It is, as far as Department of Children and Families goes, one of the highest needs and priorities for our foster care, for our child welfare system, because, you are basically removing a child from the home because of the affordable housing not being affordable. It kind of goes against every moral and ethic there is. So, I'm looking forward to see what the county is working on as far as the projects and whatnot, but nothing right now. There are prospects, but it's going to take time. Housing is not something that kind of grows out of the ground.
It's interesting, when you say affordable housing, in my mind, I'm having to translate that in health. What does that mean health-wise?
A lot of stress.
A lot of stress. But the United Way has identified ALICE, the asset limited income constrained employed. And people who can't afford housing, I know we talk about this a lot, they have to make decisions about what they're going to do with the little money they have. And a lot of times getting their prescriptions filled, going to a doctor, going to a dentist drops to the bottom of the list, because all the money they have is going into housing. So that's a really great way to frame that as a public health issue, is when you're struggling with a budget, trying to find housing that you can afford, the things that drop off the list are I'll go to the dentist next week, I'll go to the dentist in another month, I'm feeling fine, so I don't really need to spend any money on health right now. When in fact, they really may need that. They don't know how well they are. It's those kinds of things that I always try to think to myself, how do I translate that into public health? And that's how I would translate affordable housing into public health, is people forgetting to do their healthy things they need to do because the money is so, and the stress, absolutely the stress, completely.
That crosses actually all ages. It's not just the families with children. It's our seniors who have worked their whole life. Now they're living off of the fixed income, pension or Social Security or whatever it is. And there is really no affordable housing anymore. That's the whole point. Something we used to call affordable, it's not affordable to our families at the current pay rate, right? So we need to think about that housing to kind of bring it back down, whether it's COVID pandemic, whether it's the landlords, rising up the rent and whatnot. It has been a lot of going on in the last 2-3 years. We really need to think hard of how to bring those housing prices back down so our community, our people in the community can afford. Instead of, just being kicked out, literally kicked out from one month to the next, from one place to the next, because they cannot afford. They're promised one rent this month, yet the landlord comes back and says, well, no, I'm going to raise the rent. Now they cannot afford that place either. So, it's really hard on everyone.
When I was living in the Keys, I remember the Monroe County School District, they actually had a special program, and I think it had about 400 kids in it, a program for kids who were living out of cars. That's a huge health issue. That's a huge one. Kids having to live out of a car.
And remember that before the pandemic, the Bradenton Kiwanis would sponsor Christmas in August, and it was at the Lecom Stadium, and there were over 2,000 students registered to come to that event. It doesn't necessarily mean you're sleeping on the street, but you're moving from couch to couch. And there were over 2,000 at that time who came to the event. So again, another aspect of public health.
And these are events that help people short term, but the survey results that we get help us to develop actual groups and partnerships that could help maybe provide a more permanent solution than just a one-off event where we're giving food out,
I want to add something, because that's a great point. You talked about the survey. I received some great feedback tonight, even about our survey. And if we look at how technology is advancing, and if you see here, we have a QR code and we have the survey on the computer. And one thing to think about is being able to train people on how to use those things. That's one aspect of it. If someone does not know how to use it, that may affect their health, because yes, it can stress them out if they don't know how to use it. But then there's another side of that, of being inclusive and making sure that we have various ways for folks to take it. So I got some great feedback about even possibly having the survey on the paper. Just all things that can affect someone else's health, and how we provide access to make sure everybody has an opportunity to participate and give feedback.
Anything else in that?
I don't have any other questions. Any other things?
Again, we so appreciate your coming. And Kayla, if you would like to close for us, and also just remind everybody there's some giveaways here for you we want you to take with you, as well as some snacks.
Snacks there.
This evening, the Florida Department of Health in Manatee County presented a town hall opportunity for the community to come together and talk to us about their healthcare priorities for our upcoming community health assessment and community health improvement plan. So tonight we gave a little bit of an overview of what the health department does, what is public health in our community, and asked the individuals who participated tonight to tell us what's important to them from a public health standpoint, and to take our survey that we hope many throughout the county will take as we determine our goals for the next 3 years as it relates to health care issues in our community. So they also heard an overview of the health department, got to hear about our Medical Reserve Corps and how people can volunteer if they want to assist during disasters, and also more about the community health programs that we offer at the health department, and how important partnerships are in everything that we do, so we can work together to make Manatee County the healthiest it can be. The health of every community really is made up of many different priorities. We know from the assessment that's done nationally every year that ranks the health of every county. Manatee is currently 14th out of 67 in Florida. 40% of the health of a community is based on socioeconomic issues. And we heard a lot of that tonight. Discussion about affordable housing, about homeless population. How do we assist with those types of issues? Education, crime, because all of that relates to health. 30% is related to those individual choices that we make. And we heard some of that tonight as it related to substance misuse. 20% is access to health care in the community, and how that can be an issue as well, making sure that we have enough providers and we have easy ways to get the care that is needed, and preventive efforts, screenings as well. And then finally, the 10% is the issues are the issues surrounding environmental health. And we know in our community we've had the red tide, we've had the blue-green algae, and how does that affect one's individual health as well? So all of that was discussed tonight in different priorities. A lot of focus, obviously, on children, the 0 to 5 population. How do we make sure they get to a healthy place by starting off with those good choices that will help them throughout their lives as it relates to their health?